A good day to all of you. As usual, we start by paying obeisance to the founder, pioneer of Lajpat Rai Maharaj Neurotherapy with the usual invocation in Hindi. Yug Purush, Dhanvantri Swarup, Neurotherapy ke Janak, Param Pujya Guruji, Dr. Lajpat Rai Maharaj Ji ki Jai. And today's topic is, of course, we are continuing the FAQs and what answer should be given. These are questions based on so many lectures of Guruji, questions and answers based on so many lectures of Guruji, and they are very useful to know the correct answer. Okay, so the first question which many people ask is that I know neurotherapy is giving good results, but then after a disease is cured by LMNT treatment, will it recur? And what should be done to prevent the recurrence? So the main fact is that LMNT does not limit itself to only offering symptomatic relief. It corrects the body systems and not only the symptoms. By doing so, it sets right the root cause of the disease. Once the root cause is corrected, not only the particular ailment is benefited, but all other symptoms associated with that root cause also get eradicated. So very important that they have come to us for a particular problem, but they may have so many other minor ailments, etc., which are based on the root cause of their problem. So they not only their particular ailment gets benefited, all other symptoms also associated will also get eradicated. So logically speaking, the symptoms should not recur. They should not appear again. But will it happen just by our treatment? Then the answer is no. As written above, the root cause for appearance of diseases is not following healthy habits of food, drink, lifestyle, and indulgence in negative thought processes. Some diseases are linked to tension and stress to such an extent that the person appears to be healthy for a number of days, but the moment he is forced by circumstances to face a tension or crisis, the symptoms of the disease return. So in order to be healthy, such persons are advised to have a lifestyle modification. This is what we often harp upon, along with improving the power of positive thinking. Also, they should periodically visit the nearest LMNT center and take treatments for stabilizing their powers of digestion and absorption. And in addition, other treatments necessary for their constitution. By doing so, they will not only prevent recurrence of their present ailment, but will also prevent appearance of other disorders. So that means if they follow all the rules and regulations of natural living and they take periodically treatment from LMNT, then after a disease is cured by LMNT, it should not recur. It will not recur. And we have given the tips to prevent recurrence. Okay. On an average, how many people have been benefited by this therapy? Since 2001, LMNT centers have been started by Guruji students in various states of the country. And now in some states abroad also, in some places abroad also. Over the past 15 years, the total number of centers is more than 2,000. This is an earlier figure. Now I will say it is more than 5,000. Okay. So over the past 15 years, the total number of centers is more than 5,000. Out of these, there are at least 1,000 centers which have been in operation for more than 10 years, where LMNT is the sole mode of treatment. That means they don't do any other treatment other than neurotherapy. And Out of this, we are calculating average number of patients taking treatment per center per day is 20. This is a very small figure. There are some centers which have 30 to 35 people per day. Okay, but we have put it in approximation 20. And then on an average, 3 to 5 new patients per center are added every week, because by word of mouth publicity, the new patients keep coming. So that means we will say 20 per month. Say 5 means 5 patients per week means 20 per month. So from 1,000 centers, it is around 20,000 new patients per month, or approximately 2.5 lakh people are getting benefited annually. And this is with the tongue in the cheek. I have given the low figure. Okay. So in reality, it may be even more than this. But 2.5 lakh people getting benefited annually, and over the past 10 years, actually it is 30 years, but we will say over the past 10 years or 15 years, neurotherapy has been very, very active. So then you can imagine this figure is more than 25 lakh people for the past 10 years. And this is now very, very important. What is Guruji's dream mission? What is Guruji's dream mission or grand vision? Establishment of 10,000 LMNT centers all over the country in the shortest possible time frame. So for that, we invite all persons to learn this therapy and assist him in fulfilling his vision. Now at least 50% has been done. We have around 5,000 LMNT centers. So another 5,000 we should come within the next 5 years or so. We should definitely have another 5,000. Okay. Now a very common question for those who eat non-vegetarian food. Is it necessary for all patients to avoid eating non-vegetarian food? Certainly, all patients should avoid eating non-vegetarian food. But this rule is not only for patients. Guruji recommends that it is best that if you want to remain healthy, all persons should avoid eating non-vegetarian food. Then we will also later come to the answer why Guruji says so. Okay, this also will come. Now, what are the ailments that can be successfully treated by neurotherapy? We have seen a list earlier also. Most of that list is correct. We may have added a few more. Okay, LMNT corrects the systems, and almost all ailments can be treated by it. Over the past few decades, LMNT has been bringing substantial relief in a variety of common diseases such as acidity, chest burning sensation, cold, cough, all types of fevers, including malaria, typhoid, and jaundice, asthma, bronchitis, and cardiac asthma, then allergy, psoriasis, and other skin diseases, autoimmune disorders, then avascular necrosis. AVN stands for avascular necrosis. It is called avascular necrosis of the femur. It normally attacks there only, the femur bone of the thigh. Okay. Then arthritis, neck pain, back pain, joint pain, high blood pressure and low blood pressure. Then we have atherosclerosis, then IHT, ischemic heart disease. This is a very common heart disease. And then MCI, myocardial infarction. All these diseases will be discussed, okay, later in the higher levels. Okay, hole in the heart, carpal and tarsal tunnel syndrome. A disease which comes in the hand, it is over here in this wrist. So that is called carpal tunnel syndrome, and a similar place in the ankle, it is called tarsal tunnel syndrome. Then bed sores, diabetes, gallstone and kidney stone, paralysis, cervical spondylosis and lumbar spondylosis. Then slipped disc, spondylitis. This again, cervical spondylitis and lumbar spondylitis. Then spondylolisthesis. This is usually for lumbar region. spondylolisthesis, then constipation, IBS, irritable bowel syndrome, Crohn's disease, piles, anal fissures, prolapse of rectum, fibroids, tumors, menstrual disorders, infertility, hormonal imbalances. These are all usually with women. Okay, injuries and sprains, then kidney disorders, migraine and other headaches, Parkinson's, sleep disorders, side effect of medicines, ulcers, viral infections, varicose veins, pellagra, and other vitamin deficiency disorders, etc. Means there could be a few more also, but at least, but this is a good representative list of what all diseases can be benefited by neurotherapy treatment. Then the following ailments can be treated by LMNT without recourse to surgery. Surgery, there is a condition called club foot, in which the foot becomes twisted like that. It gets twisted to the inwards or outwards. Some people it will go like this, some people it will go like this, the foot. So that is called club foot. Then hole in the heart. These are all normally treated with surgery. Then prolapse of uterus, then kidney stones, gallstones, spur, etc. Then the following diseases are said to be incurable by medicines. Among them, you have hepatitis, A, B, C, etc. Then thalassemias. This is called major and minor thalassemia. Then we have sickle cell anemia, then aplastic anemia, Fanconi syndrome, bamboo spine, motor neuron disorders, muscular dystrophy, multiple sclerosis, the leukodystrophies, West syndrome, kidney failure, polio, and HIV too. So all these, in all these places, we have had some success or other in some patients or other. Okay, and again, some of them may have multiple organ failures, etc. In that case, it takes much longer time, but they definitely get benefited by neurotherapy treatment, whether they get totally cured or not. For example, leukodystrophy and West syndrome, they are all very difficult diseases to be cured. Allopathy says there are no cures at all. So, but there also neurotherapy has been seen to provide good benefit, especially improvement in the quality of life. Okay, so that's what I write. LMNT is able to improve the quality of life of above patients and their caregivers too. This is something we must keep on harping. That is why I think this is probably the 6th or 7th time I have used this word, caregiver and quality of life. Okay, this is something which is very, very important. Normally, for example, just to give an example, if you are in a hospital going situation, that means you are getting results with hospital by some surgical procedure, etc. But the quality of life of the caregiver during their stay in the hospital as well as later, their quality of life may not improve. In fact, it may deteriorate in the sense that they have to take more care of their patient. In some cases, when the patient comes home, so the caregiver has no rest, no time for rest. But here, it is just the reverse. The moment neurotherapy steps in and the person starts getting a little bit of benefit first, but then the quality of life improvement starts for both the caregiver and the patient. So that is where this scores much better than any other therapy in this case, okay, or any other medical therapy. The greatest contribution of Dr. Mehra to ailing humanity is that after LMNT treatment, varying degrees of improvement is seen in the following disorders of children. So now we are coming to specific children diseases. They are cerebral palsy, mental retardation, epilepsy, fits. That is, epilepsy is fits or seizures also it's called. Then autism, ADHD, dyslexia and associated disorders. Okay. Then disorders due to folic acid deficiency such as spina bifida, meningomyelocele, and that there is some improvement is vouchsafed by the parents of such children. That we are not telling it by ourselves. The parents of such children have been voraciously telling us that they have sound benefits. Okay. The above list is purely illustrative and by no means exhaustive. It has been enumerated solely to make the general public aware of the wide potential of this therapy. To date, there are more than 5,000 centers all over India, from Kashmir to Kanyakumari and from Mumbai to Manipur, where this therapy has been bringing substantial relief to great numbers of patients suffering from all types of ailments. Okay, so this is it. This is all to tell you what a powerful tool is been given to us by Dr. Mehra. And we are now we have to take it forward. That's all. Okay. We are now his representatives, trying to his ambassadors, taking this therapy forward. Okay. Now, the question which was asked earlier, why is it essential for all patients to avoid non-vegetarian food? Improper functioning of the digestive system is the root cause for most disorders. Non-vegetarian food contains heavy proteins and fats which are not easily digested. Nowadays, people in cities have a sedentary lifestyle. They do not do much such manual work which may necessitate eating such heavy proteins. That means the amount of manual work being done by the people nowadays in cities, at least in villages, some people may be doing a little bit more manual work. But in cities, the amount of manual work is so meager that eating such heavy proteins is not necessary for them because they cannot digest it. That's it. Improper functioning of the digestive system. When a person comes to us for treatment, it already means that their digestive system is dysfunctional. Dysfunctional means not functioning to the optimum. Otherwise, they would not have fallen sick. That's what Guruji would say. See, if they have fallen sick, the patient, it means his main system is not functioning properly, that is the digestive system. So under such circumstances, so when he is sick, the body would be unable to digest or assimilate materials, nutrients from non-vegetarian food. So if food is not properly digested, then it causes an accumulation of toxins, which causes a burden on the liver, kidneys, and skin. Okay. Okay. These are the three organs which have to work overtime to throw out toxins from the body: the liver, the kidneys, and skin. These are the three organs which have to work overtime to throw out toxins from the body. Why overtime? Because the accumulation of toxins is not for a few minutes. It is a continuous process. And so they have to work overtime. Okay. Another factor has to be taken into account. Animals which are reared for the purpose of business are periodically given special diet with high doses of hormones so that they become fat quickly and thus become profitable for their owners. This is simple to understand. And to keep them free from diseases, such animals are also given a number of antibiotics and other medicines which eventually accumulate in the flesh of such animals. So whatever antibiotics or medicines are given to the animal, it will accumulate in the flesh which is being eaten by those who are eating non-vegetarian food. Okay. Naturally, the side effects of all these different medicines will definitely affect the person who is eating their flesh. That is why Dr. Mehra insists that one should keep away from non-vegetarian food if one wants to remain healthy for a long time. That is the important. He says, I don't say you don't eat. If you want to keep healthy, better not eat. That's all. Okay. It is our experience that in diseases such as muscular dystrophy, MS or MND, MS means multiple sclerosis or motor neuron disorder, when the patient becomes somewhat better after taking our treatment for a few months, and then they take just the soup of non-vegetarian food just once. It could be fish soup or chicken soup or whatever. Okay. He has taken our treatment and he is somewhat better. Then they take this just once. Somebody will say, "Arey, try it, yeah, now you are becoming better. Come on. Now don't be fussy. Eat just one spoon, eat just one cup, whatever." Then the patient's health deteriorates so greatly that sometimes our efforts of those months becomes negated in just one day. Yeah, this has happened actually. Well, I'll give you that example also. That it becomes a Herculean task for us to bring the patient to the level he was 24 hours earlier. From this, we can understand the harm caused to the body by non-vegetarian food. So what is that example? We had a boy, his mother was a nurse and he was only around 7 to 8 years old. Very nice boy. And he was afflicted with this disease called muscular dystrophy. Okay. In muscular dystrophy, one of the very preliminary symptoms is that the child will not be able to keep his heel on the ground. It will always be raised. Okay, this is the preliminary thing, and his calf muscle will be very tight. And as a result, what will happen when he tries to walk? He will keep falling. Every now and then, he will keep falling. Okay, that boy came to us for treatment, and his mother is a nurse. So she knows that there is no cure in allopathy. So she had heard of neurotherapy. She came to us for treatment. And I think it took us about 2 weeks or so. In 2 weeks, the boy was not falling. His calf muscle had become better. And his foot, which was raised high, it was almost near the ground. I will not say it was completely near the ground, but almost near the ground. Okay. And then they stayed there only for 2 weeks. The mother was happy. And then we taught her some treatments and say, you go on giving this treatment regularly, and now your son is becoming better, so don't worry. Now this went on. After about, we have forgotten the whole incident. After about 2 months, the mother comes to the ashram again, hospital, and she says, see, my son is now again, his foot is raised. He said, what happened? Were you giving the treatment? Yes, I was giving the treatment regularly. Then she sheepishly confessed. What to do? She cannot tell the lies, no, because Guruji is very shrewd. Then Guruji asked just like that, what about his diet? You are following everything? Sir, that is what I want to say. Just 4 or 5 days ago, his grandmother, she was very much insistent. We are all non-veg eaters. We cannot be without eating fish and all that. Fish is our staple diet. They are from a place called Konkan. Konkan is in the western Maharashtra, western India. And that is there, everybody eats meat, eats fish. It's compulsory for them almost. So his grandmother, she gave him just 1 spoon, sir. Just 1 spoon, sir. Nothing much, sir. 1 spoon of just the soup. She did not give him fish. The boy was adamant, but she said no fish. Then we told her, see, look at this now. What has happened? Now again his leg is raised. It took us so many days to come back to get it down. It took us 2 weeks of 5 treatments a day. We are giving them. Okay, for in the hospital. So 2 weeks treatment all gone to waste. Again, and now again he was started to fall naturally, because when his leg is raised, you cannot walk normally. So he started to fall. And after that, we put him in again, we took him back, gave him treatment for 3 weeks. And then, even then, we were not satisfied. Then we told her, okay, 3 weeks is enough. Now you go and give the treatment. After about 8 months or so, the lady said, now his leg has come down. His leg is better. So look at that. That means just the soup. And this was fish soup. It may be the same for chicken soup also, mutton soup also, anything. So that is why Guruji used to say, please, especially such children, such patients who are having these serious disorders, for them at least non-veg is taboo for the rest of their lives. He says, after they become totally cured, which itself will take a long time, they should not make this mistake. Okay. Now, again, another way of explanation. Allopathy does not lay any restriction on eating non-vegetarian food. Why does neurotherapy insist on avoiding non-vegetarian food? Okay. So here Guruji gave another type of explanation. Every activity done by our body, right from breathing to working on a computer, requires energy which is to be obtained from the food we eat. Yeah, all energy we get is only from the food we eat. If the food we eat gives us more energy than that which is utilized by the body for daily activities, then we feel fresh and energized. In this connection, let us remember the fundamental principle of the body, that for energy to be obtained from food, it is essential that it should be properly digested and the nutrients be properly absorbed. That means just by eating supplements and vitamins and everything, we are not going to benefit our body in a non-veg food or anything. It has to be properly digested and the nutrients should be properly absorbed. Okay. For pushing the food eaten through the body from the mouth to the anus, that itself requires a substantial amount of energy. This depends upon the ingredients in the food. A lot of energy is required to pass the food from the mouth through the esophagus to the rectum. These are all parts of the body. We will see this later in the digestive system. Okay. The food pipe and the esophagus and to the rectum. Up to this, the energy is required to pass the food. And this amount of energy required mainly depends on what the food contains. Generally, people think that cooked food will be easily digested and raw food will be digested late. But the truth is just the opposite. The body has to work very little to digest salads, sprouted food or fruits, etc., and to expel the remains through the stool. But a lot of energy is spent in digesting oily food, spicy food, things made from paneer, that is the local cheese, and then cheese, then chickpeas, we call it chole here, or refined flour, etc. That is why some people feel tired or sleepy after eating such food. Why? Because a lot of energy is spent in digesting that food. So the body does not have energy to remain active. It wants to conserve energy. So it puts you to sleep. Okay. The most harmful among these are packed food and non-vegetarian food. Some chemicals are added to packed food so that they last longer and do not get spoiled quickly. Even chemicals can cause adverse effects. It takes several times more effort to digest non-vegetarian food than the energy we get from it. That means the energy required to digest the non-vegetarian food is much, much, much greater than what we can get from it. Okay, especially when the digestive power of the person is weak. That is why Guruji always says that there is no benefit in eating eggs or heavy proteins when we are unable to digest them. And then you will say, oh, I can digest everything. My digestive power is very strong when in normal people. Okay. Then he would say, even if we can digest them, even then there is no need to eat them when we can get more energy from fruits and vegetables with less effort. That means whatever energy you can get from eating eggs or heavy proteins, better energy you can get from fruits or vegetables with less effort, especially with sprouts and all that. You should add also sprouts. Sprouts are a very good source of energy. Okay. When we fall sick, even if we are lying down, some energy is still required for the functions of our heart, the respiratory system, and brain. That is why very light food is given during illness, and that too should be in a quantity less than hunger, so that the body does not have to put in much effort to digest it and send the remains forward. That means when you are sick, suppose you are having fever or any type of illness, at that time, why light food is given? Because the food quantity also should be less than the hunger. That means if a person feels ravenously hungry, you should not be given a lot of food when he is sick. It should be limited. Why? Because to process that food, the body will require energy, and already it is convalescing. It is trying to recover from the disease. So at that time, so if you give it a lot of work, then naturally it will not be able to do it so properly. So that is why it should be in a quantity less than the hunger. Good or suitable food is that after eating which the person immediately feels energetic and strong. You can try this. You eat sprouts for breakfast and then see how much energetic you feel. On another day, you take some pasta or any rice preparation, burger, whatever, something else which contains a lot of carbohydrates, or even paneer, etc. You will think paneer is very nutritious. Paneer means cheese. So then try to eat that food and see whether you feel the same amount of energy. No, you will feel lethargic. You will not be feeling like doing so work for some time at least. So that is why this is what he says. After eating which, a person should immediately feel energetic and strong. The best example of this is coconut water or fresh juice of seasonal fruits. Seasonal fruits and or vegetable soup, etc. Not paying proper attention to food and drink is the foundation of diseases in the body. And in this, Guruji would say, a full coconut it contains everything that you require. It contains carbohydrates, proteins, fats, all in balanced quantity, and that is very good for the health. Okay, so you can have fruits with coconut, etc., whatever way you want. Okay, now, can LMNT treatment and yoga be complement to each other? Certainly. Some of the LMNT treatments mimic the effect of some of the asanas. For example, we have in LMNT a treatment called gas eye. The gas eye treatment in LMNT stimulates digestion and absorption. And here it is working similar to Vajrasana. Now, Vajrasana stimulates the Vajranadi. Even our gas eye treatment stimulates the Vajranadi. Okay. Then the effect of Kundali treatment. We have another treatment at the tailbone that is called Kundali treatment. That mimics the effect of a treatment called Virasana or Hanumanasana. The way it is to be. And this Guruji used to say this Virasana, he used to show that if you are able to teach it to children, their memory power will increase and their attention span will increase. And even some children have been known not to have fits if they do this. But of course, people with fits, they will not be able to do it so easily. But he used to say that this Virasana is very good for memory power, for improving memory. Then LMNT heals the defective organs, while yoga helps to stabilize and maintain the body in good condition. So both of them are working synergistically, complementary. People who are unable to perform any asana due to body pains or stiffness, such persons can be first treated by LMNT, and once they recover substantially, they can maintain good health by regular practice of yogic techniques. Thus, LMNT and yoga can be complementary to each other. So these are some of the very important FAQs. Now I will come to a different set of FAQs where, this was at a meeting. We had a Zoom session organized by, there is one Vyasa Yoga in Singapore. They had organized a Zoom session about, it was called Neurotherapy preview session. Okay, and here some of the participants, they had asked some very, very wonderful questions. So that is why I thought that also you should understand and you should know, because these questions may be asked by Indian participants also. So this was participants are mainly from Singapore, but it can happen. So let us see. Okay, what happens during a typical therapy session? So this is a curiosity for somebody who has never been exposed to neurotherapy. They will say, what happens? Let us explain. During a session, the experience is very vast. That means everybody will not have the same type of experiences. Why? Because due to difference on constitution from person to person. So because of the differences in constitution, no two persons are similar, and even the same person on different dates has different constitution. So during a therapy session, the experience is very vast and varied. The therapy promotes increased blood flow to selected organs, and we decide the organs to be treated after careful study of the patient's symptoms and certain unique pain points around the navel discovered by Dr. Mehra. That means when we are increasing the blood flow to the organs, how do we decide it? One is this patient's symptoms, and then the pain points around the navel, which you will be studying in great detail. So those pain points, what information do they give? And based on that, the treatment is selected. And since the treatment is custom made for the patient, the general experience is very calm and reassuring. Many people are surprised with the results seen within a few days. A few even confess that they never thought that they would get any benefit at all just by pressing hands and legs. This is also something which many people will say. Oh, you are just pressing hands and legs. What is so great about it? So once they get the treatment, if they get the correct treatment, then they will change that tune. They'll say, oh, we are really surprised because they get results. And they themselves know the results and they confirm the results. Okay. Then there is one distinct system called neurofeedback. Is Dr. Lajpat Rai Mehra's neurotherapy the same as neurofeedback? Actually, it has got 2-3 names. One is called neurofeedback, or another is called biofeedback neurotherapy, etc. These are internationally acclaimed treatment protocols. And what is it? It is a computer-based system which uses a computer EEG program to process your brain signals and provide information about various brainwave frequencies. The brain produces measurable electrical signals or waves. While you are sitting in a chair, the therapist will attach sensors to your scalp. The computer program will process your brain signals and provide information about various brainwave frequencies. So it is a totally computer-based program. Neurotherapy is not at all, it has got no equipment at all. Okay. Then how good it is? It's very good. Biofeedback neurotherapy, that is this other therapy, not our therapy. It offers several advantages for managing various health conditions and improving overall well-being. Biofeedback helps individuals to learn to control bodily functions like muscle tension or blood pressure, which can reduce symptoms of conditions like anxiety and chronic pain. Also known as EEG biofeedback or neurofeedback, it focuses on training brainwave activity to improve cognitive function, focus, and mood. The reason why I am giving this much information is because this information is freely available, and we don't want people to confuse our therapy, neurotherapy. Our neurotherapy is just a generic name. It is for Lajpat Rai Mehra's neurotherapy. But this biofeedback therapy is a different system. So it has got some number of advantages which you should know. And we also provide these things, these advantages. That is why, but in different fashion. We don't use the computer feedback. So advantages are stress and anxiety reduction, It helps individuals identify and control muscle tension, which is a common source of pain and anxiety. I have seen one of these programs. The patient is he he knows where his pain is, and then he touches different places on the map, and on touching a particular place, I mean, map means the computer, this thing, they will have something for him to work with his the mouse, and then the moment he touches a particular thing, where his pain and anxiety is relieved, another place he touches, it will pain too much. So like that, then he knows, oh, I now have a tool to control my pain and anxiety. And so he keeps on pressing that portion. I mean, they will tell him how to do it. And then it also works, no doubt. But how long that effect stays and all, I do not know. But it must be good. It's a very well-known, acclaimed therapy. Okay, then another one is pain management. So one is stress and anxiety reduction, pain management. Biofeedback can aid in managing chronic pain by helping individuals learn to relax muscles and reduce pain sensations. Yeah, the person himself learns over, I think, 2 weeks or so, he will learn how to relax his muscle much better than what he was doing earlier. Earlier, he never knew that his non-relaxed attitude is the cause of his pain. So now he has learned it. Then that is very good. In fact, I have seen its effect even in, I think, autistic children. But it's a very costly therapy that way. Okay. Then it can also improve cardiovascular health. Respiratory biofeedback is a type of biofeedback. It can help manage high blood pressure by improving breathing patterns and reducing sympathetic nervous system activity. All of this we can do by our therapy also. We do it in very simple and very non-invasive methods. Of course, here also they are only putting something to the scalp. They are not, it's not an invasive procedure, no doubt. Okay, then other conditions. Biofeedback can also be beneficial for managing symptoms of conditions like urinary incontinence, epilepsy, fibromyalgia, etc. So now these are all very good for the old people. Urinary incontinence is a problem in the West, and for that also it's very useful. Now, what is our word? Dr. Lajpat Rai Mehra's neurotherapy, which we practices, uses no equipment of any kind, and it still can produce all these. It still can help in all the above cases. Okay. Acha. Then I was telling them that we change the flow of blood, lymph, and nerve impulses. How is that achieved? Our treatment technique involves application of pressure at specific locations for specific duration and in specific sequences formulated by the late Dr. Lajpat Rai Mehra. Every area of the body is innervated and supplied with blood and lymph channels. This is known to physiology, that every area of the body is innervated, means it is surrounded by nerves. I mean, there is a nerve connection for every part of the body. And then every part of the body is supplied with blood and lymph channels. So when we apply pressure by our technique, the flow of blood and lymph in the area underneath are modified by us according to a set protocol. This has an immediate effect on the flow of blood and lymph in a corresponding distal location in the body. So when we are pressing in a particular place, some other place, distal location, there the blood and lymph are also modified, or they are also affected. Okay. So by this method, our treatment improves and strengthens the innate immunity of the body without medicines. In any case, medicines are but artificial props with little or no benefit in the long run, not to speak of side effects. Okay. Medicines means you have to keep on taking medicine for the rest of your life. But in neurotherapy, it is not so. Okay. We have specific treatments behind the ears for stimulating the cranial nerves, the hypothalamus, the vagus nerve, etc., which we use in different circumstances, in different sequences, to improve hunger, thirst, sleep, reduce anxiety, etc. all of which are related to the nervous system. That means when we apply pressure by our technique, we are addressing blood and lymph, and then when we have treatments called medulla treatments, then we are able to address the hypothalamus, the vagus nerve, etc. And by doing all that, we are able to correct the flow of blood and lymph and the nervous system. Then somebody asked, can you treat neurofibromas and schwannomas? These are all nerve sheath tumors. The treatment will be useful. However, such patients are few in numbers. They come to us only after they are declared by the hospitals as beyond any hope of cure. Even so, the few persons who have taken our treatment, have been benefited in varying degrees. Even so, the few persons who have taken our treatment have been benefited in varying degrees. Okay. How about a stroke recovery patient? Does neurotherapy help? Yes. Almost all stroke patients are substantially benefited by our treatments. Many patients have felt considerable improvement in their faculties and functions within 8 to 10 weeks even. Once again, the rate of recovery differs from person to person. It is dependent on the patient's constitution, how soon he or she comes to us after the stroke, and the degree to which his organs are affected. Recovery is quicker when not accompanied by other chronic disorders such as diabetes, liver problems, etc. That means if a person is just having stroke without diabetes, or if he has stroke without any fatty liver or liver problem, then their recovery is faster. But if they have all these problems, even then they can recover, but that takes a longer time. Okay, how do you treat fibromyalgia? How long will it take? Our treatment sets right the internal constitution, and so relief from aches and pains. Fibromyalgia means a lot of aches and pains. So relief from aches and pains can be experienced by the patient within 10 to 15 sittings. However, any chronic ache or pain has a psychosomatic component, which is also affirmed by yoga and Ayurveda. So the treatment may take a long time in fibromyalgia, depending on the person's internal makeup, age, past history, etc. In our experience, several patients all over India have experienced or expressed substantial relief in their conditions after taking our treatment. Is there any age limit for the children with cerebral palsy to undergo this therapy? What is the age and improvement ratio? As such, there is no age limit for anyone to take this therapy. However, the earlier the child takes our treatment, the easier it is for results to show up. As the child becomes older, it becomes difficult for parents. Our methodology in such cases is to teach the relevant treatments to the parents on a periodical basis. But for that, they have to keep in touch with us for regular follow-ups. Now here, we will show you a letter from our therapist from Croatia, is from another place, which describes the benefits seen in many children, may help you to understand what to expect. So I will put this letter in the group. This is from Croatia. One lady has been practicing neurotherapy there, and she has given a letter seeing the benefits in many children. Okay. What are the limitations of neurotherapy? As such, I am aware of none. Unless you feel it is time consuming and requires effort to both take and give the treatment, whether to oneself or to others. So this is the only if at all you say this is a limitation, then neurotherapy is time consuming and it takes effort to both give and take the treatment, whether it is to oneself or to others. However, the benefits far outweigh the time constraints. In these difficult times of low immunity, neurotherapy is a godsend method of treating oneself without medicines. I recommend that all persons should opt for this technique as a cost-saving and safe measure. Okay. Then, are the positive results permanent, or the patients need to keep having neurotherapy? We have already seen this in different way But let us see what another way of seeing it. Depends on the type of ailment, the age, and the patient's willingness to follow a natural, healthy lifestyle and regular habits of food, drink, and rest. Because in abroad, that is their very great problem. They may not be able to have regular habits of food, drink, and rest. Okay, and they may not be always able to follow a natural, healthy lifestyle. So that is the limitation. That's why I wrote this. If it is an acute condition such as an injury or allergy or inflammation, the treatment results are more or less permanent. Even disorders, if not of long duration, such as hypothyroidism without autoimmune involvement, that means there are two types of hypothyroidism. One is with autoimmune involvement, that is called Hashimoto's thyroiditis. Then you have other, which normally many people get, many ladies get hypothyroidism. That is all non-autoimmune. So they are usually treated on a permanent basis within 6 to 9 months or so, normal hypothyroidism. But in case of chronic disorders, the patient, once relieved of most of the symptoms, may be advised to take supporting treatments at home and come for follow-up, say once a fortnight or once a month. This is true especially for diabetes and asthma. In diabetes and asthma, we have got good results, but the patient has to keep coming to us. Unlike modern medicine, where the patient is told that tablets for thyroid, diabetes, asthma, etc. have to be taken for a lifetime, the necessity of daily neurotherapy treatment is almost unnecessary when the treatment is taken till substantial and lasting results are seen. So in the neurotherapy treatment, you don't require daily treatment. Okay. When after the substantial results are obtained, you don't have to take daily treatment. Then can rheumatoid arthritis be treated at home and how much time it takes? As I said, like with all chronic disorders, the duration of the treatment will differ from person to person because every person is unique. Our treatment tries to correct the functioning of the internal constitution, and so relief from aches and pains can be experienced by the patient within 10 to 15 sittings. However, there could be waves of ups and downs depending on the degree of damage to different organs. In RA, rheumatoid arthritis, some organs get very permanently affected, okay, damaged. So in my experience, RA, like every chronic ache or pain, has a psychosomatic component, which is also affirmed by yoga and Ayurveda. So the time required will depend on the person's constitution, etc. This we have seen. In our experience, several RA patients all over India have experienced or expressed substantial relief in their conditions after taking out treatment. Of course, there have been cases of aged persons or type A personalities where results were not so forthcoming too. That means in many cases, we have got very good results in rheumatoid arthritis, but a few cases also were there where we could not get good results. And that is because of either they are aged or they were type A personality. Type A personality wants the whole world at their beck and call. Everything should be done immediately. So that sort of thing. And if that is not done, they take it to heart. And then such people suffer a lot. Okay. Does the therapy involve any breathing technique? Basically, neurotherapy treatment does not involve any specific breathing techniques. However, I advise the following methodology for chronic patients, which I have seen brings greater relief in shorter time. And what is that? Our treatment protocol has built-in rest periods in between treatments. So a treatment for half an hour is not, you don't give treatment for half an hour. It will be small breaks will be there, 1 minute, 2 minutes, 3 minutes, etc. So I advise my patients to observe the breath during this period so that their mind is not preoccupied with the day-to-day problems, which in my opinion, brings relief, that they experience greater relief during the treatment. Okay. Does neurotherapy necessarily need third party to apply pressure? Can patient press themselves? Not necessarily, though certain points on the back are easier given by others than by oneself. However, the basic points for most problems are on the front side of the body and can be taken by the patient himself or herself. Now, we are going to teach you both types, how you will treat another patient and how you will treat yourself also. So that will be done in the practical classes and demonstrations, etc. Then does neurotherapy relate to chakras and nadis? So we have specific treatments to improve the function of each organ, which is in the region of various chakras. That means we have, these are the chakras, pineal gland, pituitary, thyroid, etc. So we have treatments for all these glands. Pineal gland, we have treatment, pituitary, thyroid, pancreas, heart, navel, bladder, and the sacral region. So for all these, we have treatments. So indirectly, we are also treating the chakras. Okay. What happens if the organ itself is damaged? Now we have only a few more questions. So it depends upon the age, what you are talking about, which organ you are talking about. If it is the liver, then our treatments will help to rejuvenate it and improve its function tremendously, provided proper diet restrictions and lifestyle modifications are followed. Because the liver is the one organ which is capable of regenerating itself, even if more than 2/3 of it is cut off or damaged. That's the beauty about the liver. You know, Guruji would say that it is like there is one fish which, when cut, it regenerates itself. I think maybe it is called the starfish or what, I don't remember. He used to say there is a fish like that which can regenerate itself. Our liver is also having the same thing. At least 1/3 liver should be available. If you cut off almost major portion and leave just a small piece, then it may not happen. But 1/3, up to 1/3 liver, it has been found that it can regenerate itself. Okay. Even kidney failure patients have been found to improve by our treatments. In case of other organs, if only a part of the organ has suffered an injury, then our treatments can help to heal and function better. The prognosis will depend on a number of other factors because no organ works independently. Each body organ is dependent on other organs for proper functioning. Will this treatment be useful for ovarian cancer? Now, this is also about cancer also. A lot of questions will be there. Certainly, it will be useful. Then neurotherapy treatment improves the quality of life of such patients, especially in the area of pain reduction, improved digestion, increased energy, and better sleep. Among other things, our treatments have been found to reduce the size of tumors, cysts, and fibroids over hundreds of patients all over India. Of course, for cancers and all, they normally come to us only after they have seen all other places. In that case also, we have got treatments to help them. Okay. Now, the duration and efficacy of the treatment, it depends on two things. One is the stage of the progression of the disease. And secondly, the effect of chemo or nuclear medicines on the supporting organs, especially the liver. We theorize that our treatment, neurotherapy treatment, stimulates the production of somatostatin in the body, which is a tumor-suppressing hormone secreted by the endocrine pancreas. The rate and chances of recovery may be hastened if the person is only in the early stages of the disease and has been following natural methods to tackle the disease. However, in advanced cases, the quality of life is substantially enhanced for cancers also. Now, this is the last case. This thing, acute cellulitis, a real-life incident report from Mr. Vishal Shah. He's one of our very senior therapists. So he writes, in Dubai, I was called to handle a totally different and difficult case. The patient was the son of the chairman of what is known as Safir Group of Industries. They have a number of malls there. He was 34 years old, the son, and he was diagnosed with acute cellulitis. His right leg was swollen and reddish due to bacterial infection. He was unable to walk even for a few steps. Doctors had advised him to stay in bed all the time and lie down with 3 pillows under his leg to raise it to reduce the swelling. And he was supposed to go for an operation within the next 3 days. That was the time Vishal was there. Okay. in neurotherapy, we have a special treatment for such infection. I gave this treatment 3 times in a day for the next 3 days. And you will not believe it. I am happy to report that the swelling came down substantially, that the doctors postponed the operation. I treated him almost for 1 month, and the results were so impressive that after I returned to India, within 3 months, they invited me over to give a proposal to start neurotherapy on a large scale over there. Okay, so now this is it. With this, we come to the end of today's session. And if anybody has any queries, questions, you can always ask me. Okay, otherwise we can call it a day. Okay. So obviously there are no questions. So then we sign off. Here once again, we pray to Guruji for his blessings and for helping us to understand the vastness of this therapy and to have firm belief in this therapy, so that we are benefited to learn, to teach, train others, and to help our patients. So, Yug Purush, Dhanvantri Swarup, Neurotherapy ke Janak, Param Pujya Guruji, Dr. Lajpat Rai Mehra Ji ki Jai. May God bless all of us and our families and our friends, relatives, and their families with health, happiness, harmony, peace, prosperity, and success. Health, happiness, harmony, peace, prosperity, and success. Thank you. Jai Hind, Jai Bharat, Jai Neurotherapy, and Jai Guruji.
Thank you, sir. Thank you so much.
Thank you. Thank you. Thank you.